Mr. Kristol, as a veteran of Hillary Care and the Obamacare debates, what can you say in terms of contrasting and comparing them?
You know, early on when Mrs. Clinton introduced her proposal, President Clinton actually introduced it in a huge speech to Congress in September of 1993, everyone thought it was going to pass. How could you stop it? Newly elected Democratic president, Democratic Congress, big majorities in both houses, and it didn't go anywhere. And even though Obamacare, obviously they introduced earlier, and it has gotten at least committee markups, I think it also can fail. It's unpopular, and that's the bottom line. You know, the president has had months to sell this, and he hasn't. And just in the last few weeks, he's made a huge effort to change public opinion, and he hasn't. I think the more people look at it, the less they like it, and I think it can be defeated.
And speaking of public opinion, the Washington Post has a poll out today that seems to indicate that support is rising for a public option. Are you concerned about this? What do you think about that poll?
No, I mean, I think the public option is a complicated, small part of the plan that sounds good if you just say it to people. People are used to public institutions. They don't dislike the University of Virginia. They think it's fine if UVA competes with Washington and Lee. They think it's fine if the post office competes with Federal Express. And if you just think about public option and don't know the details, you might tell yourself, well, what harm could that do? The key finding in the Post poll is that support for the Obama plan has not increased. It's, I think, 46-48 or 45-48. It's just what it was 2 months ago. 2 months ago, Obama began this huge blitz. He spoke to Congress, prime time press conference, all 5 Sunday shows, and he has not moved public opinion a bit. That's the big story. The big story is that public opinion is settled in, hostile to this plan, quite correctly in my view. The public wants a bunch of small reforms. They do not want a 1,500-page bill that no one trusts that the Congress knows what it's doing, and that will raise taxes and raise premiums and cut Medicare and make health care worse. The public is opposed to the Obama plan, and I think that's what the latest poll shows, and that's why I think ultimately this is not going to pass. I know everyone thinks as a Democratic president, a Democratic Congress, and how can you really stop it at the end? I don't buy it. If this thing gets to the floor of the Senate, I think there are amendments to this bill that could pass that will basically end up making the bill unsustainable. Senator Reid, I think, will have to pull it down, and then next year, the Senate can pass a whole bunch of smaller reforms, which there would be quite a lot of bipartisan support for.
Mr. Kristol, thanks for your time.
My pleasure.